Hi, Claudia.
Hi, I'm sure you saw the protests happening outside City Hall today, and
Which one? I think there are a lot.
I understand that you say your decisions are going to be guided by what public health officials say, but you can tell that some people, at least, are getting restless. The governor is talking about using some restrictions next week, so I'm wondering if the thought is still to go through May 15th, or if that's something that you're possibly reevaluating at this point. Second question. People are saying that they're not able to find a testing appointment at this point, that they're just getting a message that says no appointments are available, check back later. So can you talk about,
Sure.
is the system being overwhelmed at this point? Will more slots be added? Thank you.
Absolutely. Let me start with that. Actually, the system's working great. You can get that in the morning time because we always want to make sure that people with symptoms and our first responders aren't overwhelmed. So I encourage people to check back during the day because those usually open up towards the afternoon. I have the stats today. I think we did about 8,000 tests that were, 12,000 tests. About 3,000 of them were for folks that were asymptomatic. That was about the total number of tests we were doing last week on any given day. So that was just for people without symptoms. 5,000 of those were for folks with symptoms, and 4,300 for frontline workers. We know that that's sometimes folks are going the next day or 2 days ahead. Right now, I think we're fully booked for tomorrow and maybe even Monday, but we're very confident about being able to add more tests to that. And we do encourage people to go back after noon when oftentimes we see, okay, of the 5,000 that we were reserving for people with symptoms, only 2,000 people with symptoms. We also have had a lot of no-shows. Maybe a third of people won't show up. That's been consistent through the time we've done testing. So each night I've told people, go back, get back on there, but we're very confident we can keep up with the demand that has been out there. In terms of the protests and stuff, look, I totally respect that. I'm frustrated and I want things to reopen, but 2 or 3 things to remember. One, we have to follow public health advice. This isn't about one politician versus another politician or one state versus another state. I'm going to continue listening to the professional medical advice that I get from public health. Second, we have to have a collaborative process. And as I mentioned yesterday, it's been wonderful to work with 88 mayors across LA City, our superb board of supervisors, and I'm on calls almost every single day talking about what will the process be, not just for May 15th, but May 15th is just one day where we may see the order revised. 2 weeks later, it could get revised again. 2 weeks after that, it could get revised again. It's going to be a very dynamic year ahead of us, where I hope we can have a process where we take baby steps. We assess those for a while before, which is what we're doing right now. We assess them after 2 or 3 weeks to see the impact, and we say hold, retreat, or proceed. If it's successful, maybe you can sometimes proceed. If it's stable, you hold. And if it gets worse, you have to retreat as well, because we know that lives are at stake, and overwhelming the hospital system is something that is unacceptable to us all. Third point I'd make is, while in the city we could move forward with more restriction at the beginning, this will be something in which the state and the county will be the leads on. But I intend to bring the voice of community and of industries and people who are saying, here are safe ways that we propose to get those openings, and then work together with my fellow mayors of LA County across all 88 cities and our Board of Supervisors to arrive at those things together. So I'm confident. I don't think we'll be doing it earlier than May 15th. As I said, I shared at the beginning of this, more deaths this week than last week, more cases this week than last week. So while the rate of increase is slowing, let's be clear. There are more people dying. There are more people that we are diagnosing as being positive each week. And so we have to balance those things about human life with making sure we take safe steps forward for both our psychological health and our economic health. I'm confident that we can do that in the next 2 weeks. Thanks, Claudia. Next question.
Next we go to the line of David Sennheiser with Los Angeles Times.
Hey, Dave.
Go ahead.
Hi.
Hi.
So today, a homeless man went into the Ritz-Carlton at LA Live in downtown LA and refused to leave, saying he wants you to order hotel owners to open up their doors to homeless people. And up till now, the city and county have opted to negotiate with hotel owners who are willing to participate in the program. So I'm wondering, are you disappointed by the slow progress being made on Project Room Key? And do you think it's time to commandeer hotels, which is to say, force them to rent their rooms to homeless people? And if not, why not?
So I wouldn't, that's your characterization that slow progress. I look always at a very important number of what percentage of the rooms we've already signed are occupied. Because if they're 99% occupied, yes, I would say it's moving too slow. But here's the numbers so far. Out of 1,631 rooms that have been signed on, 1,272 of those are occupied. That's 78%. So there's plenty of capacity. And I would say to that individual who's experiencing homelessness, who wants to go in, we have a room for you tonight, and we want to house you. We want to make sure that anybody who is in danger of contracting COVID-19 knows that there is a place for them to put their head tonight, this very night. It doesn't always mean the exact hotel that you might be knocking on their door, but there is a place tonight. Those are tier 1 for healthy people who are vulnerable, meaning that they don't yet have COVID-19, but they might have underlying conditions, they might be living on the streets, they might be of a certain age. Tier 2 ones, which is folks who are already sick as well, 409 rooms, 314 of those are occupied. So that's a 77% occupancy rate, which means tonight there are rooms. And I'm very proud so far of the outreach that's been done. Let me see if I can get the latest numbers. I know it's more than 5,500 wellness checks have been done on people who are experiencing homelessness. We've now done, in terms of the number of tests for folks who are experiencing homelessness as well, I think close to more than 2,000 of those, including pop-up testing that we've done in Skid Row, as you know, here in San Pedro, in other parts of the city where we see encampments. So those rooms are available. But then the last point, I wouldn't disagree with you, Dave, in this way. We can't have too many hotel rooms. And as I've said all the time, absolutely, I will use whatever emergency powers are necessary. They do come at a price, and they do come at a cost. So you can't just commandeer and not pay for those things. So if that means that suddenly we wouldn't have tests or we would have to lay off city workers or something, there's not a bottomless amount of money for that. But because there is capacity, I'm convinced that right now we're meeting the need, and I'd like to see that continue. And as I've teased a couple times, there are rooms that are continuing to be signed, and I think we have some big ones, including one downtown that we're days away from announcing. And I'm sorry, I got a correction. It's over 5,000 now. It's 6,500 wellness checks. Thanks. Next question.
Next question comes from the line of Basic with NBC. Please go ahead.
Hey, Robert.
How are you, sir? Glad to hear that the cough is no longer with you.
Don't worry. It was just something in my throat last night. I'm all good.
So here we are on May 1st.
Yep.
I heard what you said to Claudia, that you don't think we'll be doing anything earlier than May 15th. Governor Newsom says it's going to be days, not weeks, before restrictions are going to be lifted. So you're saying that, just to clarify, here in LA County, you don't see anything being lifted at all before May 15th. And will we be following those federal guidelines that we need to see trends in cases on a downward slope for 2 straight weeks before we should do anything?
Great questions. First of all, on the first one, I always give my snapshot of tonight. So that's just a snapshot of tonight. It may be that public health says, here's a couple things we can do before the 15th. Absolutely open to those. I would never do those alone. I think that's important for the cities of LA County and the county to do together. So I know that we have our teams working Long Beach and Pasadena that have their own health departments. LA County, which is the health department for the rest of us, and my office are talking every single day. And there's certain things, I'd love to see if they get the green light to go even sooner. But my snapshot is really May 15th is, I think, the day that thoughtfully you'll see the beginning of baby steps. But to be clear, they're not going to be giant steps on the first day. Everybody's preparing for a big party or the doors fly wide open. That would kill so many people in this county. 96% of us, maybe it's a little bit less now since the USC study, but over 90% of us can get infected, which means if we don't do this the right way, all the progress we fought for, all the time we spent at home would be for nothing, and we would see tens of thousands of deaths potentially here. Secondly, in terms of the first part, sorry, it was about opening up, or what was I think that was it.
The the government phase about are we going to have to see a downward trend in cases
Sorry, yeah, that was
for
right.
2 weeks before the government recommends anyone starts phase 1?
Thank you. That was
Or
your second
phase 2.
question. Correct.
Yeah.
So those are good guidelines, but I'd say two things. Diagnosed cases is different, for instance, than deaths. Diagnosed cases can also depend on how many tests are available. So I like looking at a 7-day average. First of all, as we've seen, sometimes there's data dumps, so you're going to see a huge spike one day. Even sometimes the death numbers I think we're getting might not always reflect a 24-hour period, but just when we get those reports from hospitals, and they can sometimes be clustered for a day or two, as we saw a few weeks ago when we had the highest number in a single day. I think it was 81, and then suddenly 17 deaths the next day. So it is a good measure, but you have to make sure that you're not just measuring that more people are getting tests. Second, deaths are a more honest number because you cannot fake a death. That is something that is written in stone. But we also know that death is usually a lagging indicator because it takes time for those people that we've lost for them to get sick and to die. So it's not a good daily measure. So we're looking at a series of different metrics. We'll be talking a little bit more about this next week, and the county's looking at this and my fellow cities as well. But that is one good measure. For 14 days, have you kept steady or gone down on the average, 7-day average each day? Another good measure is hospital admissions, because really what we're fighting for is not overwhelming our doctors, not making it so that our capacity can't meet the need, and that people aren't dying in the hallways. So that, to me, if you continue to have good numbers of admissions that are lower than the number of beds, that's also, I think, a really important measure for when you can open things up a little bit. And then you got to measure it. If you suddenly get a whole bunch of people coming in, you've got to know something's happening out there and potentially close the door a little bit. So those are 3 of the measures I'm looking at, and they're absolutely critical, but no one of them will single-handedly make the decision for us. Thanks, Robert.
Thank you, sir. Have a good weekend.
You too. Appreciate it. Next question.
Next, we go to the line of Alex Michelson with Fox 11 News.
Hey, Alex.
Go ahead.
Happy Friday, Mayor.
Happy Friday to you too.
Those protesters outside City Hall, most of them not physically distancing. The same thing we're seeing up and down the state. Are you concerned at the way that these people are flaunting the suggestion that you're making, and that might be a sign that people are ready to just sort of ignore what you guys are saying needs to be done?
Sure. Look, exercise your constitutional rights. That's important. It's part of being American. It's a spirit of Los Angeles. There isn't a May Day that's gone by since I've been a public servant here for 2 decades that there haven't been robust demonstrations, protests for immigrants, against officers, for the closing, against the closing. All these things are important. But please, it's not a mayor telling you to do these things. It is a doctor telling you to do these things. These are medical professionals telling you you're putting yourself, your loved ones, anybody around you, and strangers at risk. So of course, while you're exercising your constitutional rights, folks who are driving around City Hall or whatever, honking their horns, they're staying safe. Folks who are there not physical distancing from each other, absolutely. That is something that is in violation. We're seeing that around the country. And look, I don't want to look back whether I agree with somebody or disagree. And we all agree with certain things and disagree with other things, but we care about each other. I care about those protesters not getting sick. I care about their lives. And I don't want to see looking back that was a moment in which things got spread. That's the same reason, whether it's our beaches, whether it's our trails, whether it's our workplaces, or where we protest, we have to be smart, and this isn't going to be over soon. So whatever we do, whether it's work, whether it's play, whether it's protest, do it in a smart way. And please listen to the doctors who know and who have seen the consequence. If we don't, it means people die. If we do, we can maintain those rights and we can exercise our freedoms better. Next question, please.
Next, we go to the line of Ben Oreskes with LA Times. Please go ahead.
Hey, Ben, how you doing?
Good, Mayor. Thank you, as always, for doing this.
course.
I just wanted to follow up on one thing Dave mentioned. We have been seeing rooms being kind of taken for homeless people or being used by homeless people. And again, though there has been this lack of rooms downtown, we heard from you last week that said that was on the horizon. We heard that again tonight. We've also heard that activists want to see rooms that have received taxpayer subsidies be open to homeless people. Has your team reached out to, an LA Live, a Wilshire Grand, and the others that have received this taxpayer support to ask them if they'd be willing to do this? If you have, what did they say?
I don't know yet where the negotiations are. I know we have reached out to those hotels. I think that's absolutely appropriate. I've spoken with Councilmember Mike Bonin, who I think introduced a motion specifically on this. Absolutely. Look, we've helped get jobs. We've helped hotels get built. We've helped their workers, whether it was focusing on the out-of-work hotel workers that now are preparing meals for our seniors, or whether it's an opportunity for hotels to make money right now and do something good. Absolutely. I hope that people will do it for their bottom line, and that they will also do it because it's the right thing to do. But we've called more than 800 hotels, the owners of more than 800 hotels and motels. So I would continue to encourage folks to get to yes, to say yes. We do have capacity tonight, whether you're sick or not sick, in hotels, so that's good news for anybody out there worried. And if you have somebody that you know of who needs that housing, please do refer them through 211, through the county, to those hotel rooms, because they're available. And I'd like to see statistics where those rooms are growing every night and they're at 90 to 100% capacity, because this crisis calls on us to do that. Thanks, Ben. All right, I'm told there's no more questions. All right, so I'll be switching to Spanish for my address. I want to wish everybody a good, healthy, safe weekend. Thank you again for hanging in there, and I will see you on Monday. Have a good weekend. Muy buenas tardes, Los Ángeles, y gracias por venir esta noche a la Alcaldía de Los Ángeles. Hoy estamos al final de otra semana en casa. Ya estamos cansados de esto. Queremos regresar a nuestras vidas y saber cuándo podemos empezar a tomar pasos para protegernos. Les aseguro que lo que estamos haciendo está funcionando. Estamos aplanando la curva, pero este virus sigue siendo muy peligroso. Hoy es el 1 de mayo, el Día Internacional de los Trabajadores, y nos podemos quedar en casa gracias a nuestros trabajadores esenciales, quienes están manteniendo nuestra ciudad cada día. Hoy los celebramos, pero no solo los celebramos hoy, todos los días los respetamos con asegurar que estén seguros con las medidas protectivas críticas. Los cuidamos a ellos porque ellos nos cuidan a nosotros. Ahora les comparto los datos de hoy. Hoy hubieron 1,065 nuevos casos en el condado de Los Ángeles, llegando a un total de 24,215. En total, esta semana, nosotros hemos tenido más casos en la semana pasada. En la ciudad tuvimos 699 casos, llegando a un total de 11,553. Y hoy fallecieron 62 personas más en el condado, llegando a un total de 1,172 almas perdidas. Lloramos con todos quienes han perdido un ser querido en esta crisis, y esta semana perdimos más personas de en la semana pasada. Cuando implementamos nuestro orden, más protegidos en casa, nuestra tasa de infección estaba entre 4 y 5, y hoy casi ha bajado a 1, lo cual indica que el quedarnos en casa está trabajando, gracias a su trabajo. Estamos salvando vidas y asegurando que nuestros hospitales no sobrepasan su capacidad. En nuestros hospitales tenemos 1,169 camas disponibles. Entre ellas, 234 están en las unidades de cuidados intensivos y tenemos 1,210 respiradores. Y nuestra capacidad para hacer pruebas también nos ayuda en esta lucha. Hoy tenemos la capacidad de hacer pruebas a 18,000 personas al día. Y para el final de hoy, habremos hecho pruebas a 165,000 personas en el condado. Debemos utilizar todas las pruebas que tenemos. Personas que no muestran síntomas pueden infectar a otros. Y por esto permitimos que todos se hagan la prueba, tengan síntomas o no. Sin embargo, para ser muy claro, estamos dando prioridad a los angelinos con la más alta vulnerabilidad trabajando en la frente de la crisis y personas sintomáticas. Y también recuerda que la prueba indica si tienes el virus en este momento, no indica si lo tuviste antes ni que no lo tengas en el futuro. Y aunque resulta de tu prueba negativo, todavía debes mantener las medidas de sana distancia y cubrirse la cara en público. Puedes hacer una cita para una prueba en la página coronavirus.lacity.org/testing o llama 213-9-78-10-28 o al 311. Esta enfermedad nos ha afectado a todos, pero no de la misma manera. Esta pandemia nos ha mostrado el resultado de generaciones de discriminación y abandono. Por eso estoy nombrando a Capri Maddox para servir como la jefa de equidad en respuesta al COVID, para enfocarse en estrategias para asegurar igualdad en nuestra respuesta a la pandemia. Además, seguimos avanzando en nuestro trabajo para ajustar nuestros servicios municipales en la pandemia. Nuestro Departamento de Transporte ha aumentado el número de intersecciones que cambian la señal para cruzar sin tener que apoyar un botón a 900 intersecciones y cerca de hospitales. Y nuestro Departamento de Servicios de Saneamiento ha aumentado la frecuencia de limpieza de nuestras paradas de bus y ha instalado 300 puntos con desinfectante para sus manos. Mientras entramos un nuevo fin de semana, les recuerdo que los caminos y las playas permanecen cerradas. Por favor, no tomen el riesgo de salir a pasear. Les prometo que estamos en camino para la reapertura poco a poco. Este es nuestra meta en estos próximos días y semanas, a reabrir partes de nuestra vida, de nuestra economía, de nuestra prosperidad y de nuestra salud. Mientras tanto, quédense en buena salud, quédense protegidos y quédense en casa. Mucha fuerza y mucho amor de mi familia a su familia. Y hasta lunes. Gracias. Thank you all.